Well, let's talk about the evolution of hair loss in regards to the restoration surgeries. I remember in the 90s, and I was younger, I remember the hair loss for men, or there was another big one out there. And a lot of the surgeries were kind of these FUT, where they do the follicle unit kind of transplants, make the big strip from the back of the head. You see the big smiley face scar. And then enter the 2000s, the late 2000s, you started seeing FUE, follicle unit extraction. And they started bringing on some of the machines to evenly pull out those follicles to make sure your donor sites didn't look uneven. Can you just talk about kind of when you came in 25 years ago, how is that it evolved and where are we at today? Because I feel like every 5 years is a giant leap in the hair
Yeah.
transplant surgery world.
Yeah. Well, Dr. J, that was a really good summary of the history of hair transplants
Yeah.
from plug harvesting
Yep.
way back in the 60s to about the 80s and
Mhm.
90s. And then the
Mhm.
strip harvesting, we were
Yep.
all trained on that, the linear excision, which left the long telltale scar. Stitches
Yep.
or staples were used, kind of a painful process.
Yep.
And then it was exciting for me to be a part of really the group of pioneers who were moving forward with follicular unit extraction. FUE was something that was basically brand new in the early 2000s. And there was only a handful of surgeons, maybe six or eight of us, kind of trying it. And I would literally try it on each patient that was having a strip procedure. I would try to get the grafts minimally invasively. That means without a scalpel, without stitches, using a tiny, small, round instrument to pluck the follicles. Because I knew from general surgery, having done that work, that minimally invasive procedures always were more comfortable, were going to have a quicker and more comfortable recovery. And if we could leave someone without that linear scar, I just figured they'd have so many more options in
Totally.
terms of hairstyling. So it was exciting to see that. Obviously, we were one of the first to get robotic extraction devices, and that was pretty exciting back in 2016 or so. But today
Mhm.
we use manual mechanical tools that actually allow us to take the follicles in some cases without having to trim any hair whatsoever. And so over the years, you've seen this change. Numbers of graphs and quality of graphs and the consistency of the results has really skyrocketed, not just here in the United States, but also across the world. Um, so it's been pretty exciting to be on the forefront of that technology. Way back when I did my dad's procedure,
Mm.
his first procedures were done with a linear harvest, but his later ones were done with FUE. And of course, that's primarily what we do today, mostly what we do.
Now, how many donors, how many hair follicles are you recommending on average per transplant surgery? I go online, I watch lots of different surgery recommendations, and I see the fails, right? The big fails I see are
Mm,
people doing too many at once, or they'll bring the hairline, they'll bring it too juvenile, they'll bring it down too low, and then you're chasing that back up, and then you're having to use all these extra donor sites to fill that in. What are some of the big mistakes when people go into a surgery? Is there a certain amount of follicle donors you recommend per surgery, keeping it between 3 to 5,000? Do you try to just keep the hairline as natural as possible? Do you focus on the receding area or the crown first? How do you customize that?
yeah, well, certainly every single patient that I see is different and receives a different hairline.
Hmm.
So if you're out there like choosing a hair surgeon, right, what you're bringing up are a combination of what I would consider hard skills and soft skills. And so all of those little details that you just mentioned, the numbers of grafts that are needed, how many procedures should be done, where's the location of the hairline, what's the angle, the orientation, the position
Yeah.
of the hairline, is the hair that they transplant going to grow? So you want to choose a surgeon that has this experience that can demonstrate to you that his process works, actually grows the hair robustly, right? Keeps you safe, right? Doesn't put your life or your health in
Right.
jeopardy, but also has those soft skills of artistry, which unfortunately, as you saw out there on the internet, some of these medical tourism locations
Yeah.
out there, they're
Turkey.
just they're literally creating just a straight line
Oh,
across.
yeah.
And look, everybody kind of knows medical tourism is risky, and you only have to Google turkey teeth to find out what's
Yep.
going on there. That is a thing. Putting patients' lives in jeopardy, and also, screwing up their teeth is a very big deal. Just like you don't want that to happen to your hair.
Yeah.
And my dad's a dentist, so I think the teeth are kind of important as well.
Yeah.
But so finding that surgeon who has those hard and soft skills, so that they can design an appropriate treatment plan for you and execute it properly, and you end up with something that flaunts the natural beauty and symmetry of your face. That doesn't overstep the bounds of naturalness, and that has the architecture of a natural hairline. And as we said, like not something that's straight across or too juvenile, something that has a little bit of a recession on the sides,
Yeah.
perhaps. Something that's soft and wavy. That really is what's going to be effective. And then the other piece of the puzzle is the long-term or holistic approach, if you will. How do we keep the other hair that's not been transplanted hanging around? How do we keep that hair
Right.
protected? Because transplanted hair is permanent, your other hair is not. And so you want to have a robust treatment plan that not only transplants enough hair into the area of thinning or baldness, but also protects the other hair. And so that's a key component. Now, whether those are lifestyle changes or medications or other modalities like good nutrition and sleep, to medications or lasers or regenerative treatments, I mean, that's really the key to this whole thing is putting all of that together, in the clinic with a surgeon who has your best interests and safety in mind.